Hi, everyone. Stephanie with the patient story again, back with Mary, who's sharing her story about myelofibrosis. And Mary, you just went through talking about your first symptoms, trying so hard to get doctors to listen to what you were saying about what was going on, putting your foot down several times in getting the right doctor and right treatment decisions. So now we're finally at this place where, you're in the fall of 2017 and you've been told Pegasys, let's try this interferon. This is the one you need to go on. You have polycythemia vera, not essential thrombocytopenia, just like, every MPN possible.
Right.
And then finally, you do start Pegasys, right? So it's November 2017.
So I'll start with this. Before I started on Pegasys, I said to this doctor, gosh, everything I've read and everything that your colleague told me was that I shouldn't be on treatment. Now you're telling me to go on treatment. But what the MPN Research Foundation says is before you start any chemo, we need to do a bone marrow biopsy because chemo should be titrated to the bone marrow cellularity, not the blood cellularity. And he looked at me like I had a hole in my head. And he said, you're not getting a bone marrow biopsy. Like I wanted one. Who wants to have their hip drilled into? It's not exactly what you want. And I said, oh, no, you're misunderstanding. I don't want one. I feel like I need one. And he said, no. He said, that's if we needed a differential diagnosis. You're JAK2 positive. You have the JAK2 mutation. That is the differential diagnosis. We know what you have. So I said, okay. So he wanted to start me on Pegasys. And I said to him, your colleague just told me I didn't need anything probably for several years, that we were going to watch my bloods quarterly. And why Pegasys? He said, because Pegasys will turn down the volume on the platelet overproduction. It'll buy you more time. Pegasys is the drug. And I said, it just feels like you're like, do you get a kickback for selling this Pegasys to me? And he kind of joked. And I said, okay, let me just ask you this. If I was your daughter, would you put your daughter on Pegasys right now with the platelet load I have? And because what I was reading was that I should be over 1 million before I started on anything, or 1.2 million platelets. And he said, if you were my daughter, I would have you on it today. So we went home and thought about it. And I said, yes, I'll go on Pegasys. So I started on Pegasys, what seemed to be quite a high dose. And I questioned that usually people start low and titrate up. He said, no, this is the dose. This is how it comes in a vial of this size. I said, well, you can squirt out half, you can give yourself half of the dose, and he wanted me to be on that dose. So I started on it, and I was on it maybe 2-3 months, and my liver function tests got very elevated, and I felt just lousy. And I don't remember, other than my hair fell out, or a lot of my hair fell out. It was, I never lost all of my hair. In fact, this is still only about half of my hair. I had very curly hair, kinky curly hair. Now I just have kind of some messy waves. And I had a lot of hair. Now I have about half the volume of hair. I have much less curl, more wave. But so my hair started falling out pretty significantly, and I had some good spots of missing hair. And I felt just so fatigued, and it turned out these LFTs were elevated, and so they stopped the Pegasys, and almost immediately felt better. Then a month or two go by, and he says, let's get you back on. My platelets start climbing back up. So we put me back on, and I said, I'd like to start at a lower dose. And he said, no, this is the dose you're starting at. So I went back on the dose I was, and sure enough, went into the same sequelae and ended up with elevated LFTs. That was May of 18. And that's when I said, I'm stopping. I'm done. I'm not going to take any more chemo until I understand more what's going on. I asked him for a bone marrow biopsy, and he said no. And I said, I would feel more comfortable taking a drug that we're not really even sure is for my kind of cancer. I'd feel more comfortable taking this drug if we understood my bone marrow. And he said no. So I still was checking in with him monthly through to like October of 18. And I have to say, in the June, July, August, September of 18, the vertigo became outrageous. And I saw an ENT, and I was told that I didn't have vertigo, and I did. I was falling to the tune of, I tore my rotator cuff that needed surgery. I tore both meniscus in both knees, tore a labrum in this shoulder, had hematomas like the size of, pots and pans on my body from falling. And, but I wasn't really falling. I didn't have vertigo. It was impossible. So finally in October of 18, I said to this oncologist, he really wanted me to go back on chemo because my platelets were going up. And I said, I'm not going back on chemo till I get a bone marrow biopsy. So he finally agreed to do one. And I had it, and the results came back, and the results said, the words that I picked up were consistent with myelofibrosis, early stage fibrosis, fibrotic cells. So I called him because he wanted me to go back on Pegasys. And I said, this says I have fibrosis. And he said, no, it says you have PV. I'm the doctor. And I said, okay, you and I are done. I'm not coming back. This was November of 18. And in January, I changed health providers. I changed insurance providers so I could go to out of. And I will say this, during that summer, when I was refusing to be on the medications he wanted me to be on, the pharmacy was still calling me every week and asking me to come pick up the Pegasys. And I said, I'm not on it. I'm not taking it. So I called the doctor. I said, why don't you call the pharmacy and tell them to stop calling me? He said, oh, you should stockpile it. And I said, for what? I'm not taking it. And I began to wonder if perhaps he was being incentivized to have me on a drug that I didn't need. So it was very, very disarming. And so I ended up in January starting with Anthem, Blue Cross Blue Shield, and I could go to Stanford, where there was an MPN specialist. So that's the next kind of phase of this.
Wow.
Right?
Yeah, it's a lot. Just one last time, I do want to highlight this point. It is really hard because even me in my position where I talk to people and I do, I learn things about different cancers, and I talk to specialists, and it's always about patient self-advocacy. And we will talk about this a little bit later too in the third clip segment of your story, third video, on patient self-advocacy. But it is hard sometimes, right? You're feeling what you're feeling, but it's easy to explain away, especially when, and even you as a nurse, right, with a master's degree, even for someone like you to feel like, well, if my doctor is saying such and such and such, I guess maybe I'll wait and see, or I guess maybe it isn't, or it's easy to fall into that, right?
At the beginning, I think I put off going to the doctor at the beginning because I thought it was in my head, or I thought, what is this? This is like, do I have a cold, a flu, or something? But when it got to the point where the vertigo was overwhelming my life, I felt like I had no choice. I was starting to get injured, frequently injured. I can remember one time, this vertigo, this gravity comes down, and it just sort of pushed me down, and I fell against the wall, and I ended up being wedged between like my sofa and an end table. And I didn't know how to get myself up because I was in so much pain, and I didn't know how to move. The world was spinning around me, and I knew I needed help. But every time I told the doctor that this was happening, they felt like they couldn't reproduce it, and that it was here in my head.
It's tough. No, it's tough. I'm glad you did. You have shown that you put your foot down when you need to. A quick question about this. I know that you had been diagnosed with PV and then ET.
PV, ET, yeah.
Essential thrombocythemia. Did they ever, when you went to the specialist, say, yeah, you have myelofibrosis, it's secondary, or was it always primary?
No, when I went to Stanford in January of 19, I started with Anthem Blue Cross, which let me go to but you still can't get into Stanford unless you get a referral. And it took me a full year at the new insurance provider to get a referral to the wizard. I call it seeing the wizard. So what they did in January of 19, the new doc said, we're going to give you another bone marrow biopsy because this one looks like fibrosis, and we're gonna do another one. So they drew new cells out of my hip. And they said, they called it pre-fibrosis. They said, you have essential thrombocythemia, which is elevated platelets with pre-fibrotic cells. Okay, so finally, through the whole of 19, I'm just coasting along, and the vertigo is getting worse, and nobody really wants to treat the vertigo. I think nobody really understood the vertigo as a symptom of the cancer. It's very unusual. And so I finally said, can I go to Stanford? And I think in exasperation, they said yes. So I got in to see Stanford in January of 20. And Stanford took both sets of bone marrow cells that had the slides from both sets of those slides that had been drawn before out of my hip, and they re-evaluated them. And Stanford in January of 2020 said, you never had ET, you never had PV, you had primary myelofibrosis based on those cells from 2018 and 2019. I was relieved.
Yeah, relieved.
Yeah, relieved to have the worst diagnosis, but because at least I knew somebody was looking at things from the right perspective, like somebody with the right eyes was looking at that. And then they also, the real key thing at Stanford was when you walk through the doors at Stanford, you know you're at a different kind of place. Your shoulders go back, your head goes up, the air you breathe is fuller, and people tend to you. And I was immediately signing into research studies and giving extra vials of blood. And I felt like I was part of something much bigger than myself. And when I finally got in, I was interviewed first by a nurse practitioner for almost 45 minutes. And then I had the wizard himself, Dr. Jason Gottlieb, who is an MPN specialist, who's just kind of amazing. And he was supposed to spend 15 minutes with me. He spent almost 45 with me, just answering all my questions, drawing out diagrams, putting things up on the computer. He knew that I had not been treated well, and he just took the time to make sure that all my care got pulled together in that one visit with him. It was stellar.
As just someone listening to it,
yeah.
I get like a little, I don't want to say emotional, but it really touches me, I think.
It did. I mean, I felt for the first time in, what was it? At that point, it was 2.5 years of diagnosis, validated, because he said to me, yeah, the vertigo is kind of unusual, but I'm going to send you to one of our ENTs. And I said, I've been to ENTs. He said, you haven't been to an ENT who understands your blood cancer. And I said, okay. And I walked in, and when I saw the ENT, he said, I see 30 of you a week. And he said, they put earphones and goggles on me, and they could figure out what was wrong with me in seconds.
And there it was the vertigo, and you were, it was all affirmed, right? It was like
in seconds. Yeah.
So I think one thing I want to highlight before we talk about the actual treatment that you were then put on is how incredible it is that it's not even about the diagnosis, right? Like you said, I mean, it was like, wow, this is this is a lot to take in terms of the actual diagnosis. You'd prefer ET or PV, but to have someone who gets it, who you feel, with whom you have confidence, basically, right? So that's the thing.
Yeah, the biggest thing was I felt heard, I felt seen. And even if my symptoms were obscure, they were going to leave no stone unturned in trying to help me understand it. Because at the beginning, I don't think anyone really understood the vertigo until my platelets got really high, and then we started treatment and my platelets became under 600,000, and boom, my vertigo went away. And now we understand it in the context of my platelets.
Well, I am just so glad you finally got to the wizard, or Dr. Gottlieb.
It did feel like that. It felt like, oh, I knew I was in front of greatness.
Yeah.
And I have so much admiration and appreciation for him and his colleagues at Stanford.
Yeah, as we know, it is a team, right? Usually it's a team that's treating people. So then fast forward to August of 2020, you started Hydroxyurea. Now tell me just that conversation you had with Dr. Gottlieb on why and for how long and all of that.
So I only saw Dr. Gottlieb in January of 2020. And then of course, COVID hit, and all of my ENT stuff got pushed off till almost July. So the vertigo continued. It was just like, because of COVID and the newness of it, without a vaccine, without really understanding transmission, everything shut down. And those are things I couldn't do over a video call. So it wasn't until July of 20 that I saw the ENT, and they put me into physical therapy for some neck manipulation and some work around that. And August of 20, I had an event of some kind. I got up in the morning, per my usual. It was always hard to get out of bed because the vertigo would make me often fall back in the bed. Like as soon as I stood up, I feel like the world was spinning. That particular morning, I sat at the side of the bed and I felt like gravity was just pushing me, I mean, just throttling me back in the bed, such that I tried to get up 3 or 4 times and ended up projectile vomiting. And when I would look at the wall, my eyes would bob from 12 o'clock to 6 o'clock. They would just bob back and forth, up and down. And I intuitively knew that I had nystagmus, which is related to inner ear stuff, and I thought the vertigo. So I ended up doing my best to clean up my mess, but by crawling because I couldn't walk. And I went back to bed. I called out sick to work, and I ended up staying in bed for 2 days at that point. And then as quickly as it came on, it seemed to have resolved, except that I did get my local oncologist to draw blood because she was interested in understanding why, all that nystagmus and everything. And my platelets were over 1 million. And so she immediately put me on hydroxyurea to treat that. And here's the gift. Within 2 weeks of being on hydroxy, my platelets came down under 600,000. And we were watching those platelets almost daily the first couple of weeks. And almost like magic, the day they went under 600, I had no vertigo for the first time in years. I had none.
4 years. That's incredible.
Yeah.
And you've been on hydroxyurea ever since?
Since August of 20, so 1.5-ish. Yeah.
1.5 years. And it's a pill every day.
It's a pill I take every day. Yeah. At night, at bedtime.
And what are the side effects, if any, you deal with?
Well, when I was taking it in the morning, the side effects were some nausea. And so the doctor said, take it at night. And I don't notice anything. I do get some, my skin at the beginning got really like weirdly dry, almost like a snake, in that I had a layer of dry skin above my skin that I could kind of peel off. And it really concerned my oncologist because apparently, especially on the legs with hydroxyurea, we're prone to ankle injury, skin breakdown from the hydroxy. So she wanted me to start on some lotion on my legs twice a day with hyaluronic acid in it, which really calmed down the itching. And I have beautiful skin now. I don't have any of that dryness or itching. But yeah, that was the biggest thing, the weird skin for me. I occasionally have a thing where when I get in the shower, the hot water makes my skin like burn, itch. I don't know how to describe it other than it's a burning, itching, almost like, so it burns and itches so much that taking a cold shower is kind of the gift. Like you don't even mind a cold shower because if my skin's going to do that, it's but I don't get that very often. I'm pretty lucky. I'm pretty darn lucky with my symptom load.
I'm so glad to hear that. And just to clarify, you'd mentioned this before, but you're JAK2 positive, and this is primary myelofibrosis, and so earlier stage. And so is that still the case?
So I'm considered stage 1, and it's 3 stages. So yeah, very early stage, and I could continue on like this for a really long time. Now, right now, my platelets are running like 480 to 550, so almost normal platelets. And I get so excited, and I only go every 4 months now for a blood draw because they've been pretty stable. But my oncologist always says to me, it could turn in a minute. It could go out of control in a minute. Either they could dive down because the scarring in the bone marrow could get to such a place where I can't make cells anymore. But I don't have any splenomegaly. I don't have enlarged spleen. I don't have any of that. I'm lucky.
I am so glad to hear it, Mary. And as what you're talking about, of course, is with the myelofibrosis, a lot of the presentations is the enlarged spleen and other symptoms, enlarged other areas, or anemia, and it's so
None
great
of
to
it.
know that you're not dealing with any of
Right.
that. So as we wrap this part of it, you're going in for monitoring every 4 months, meaning blood work, just to make sure that the levels are okay. What are your top sort of takeaways from the treatment portion, and finding the right, the right treatment, the right doctor?
Well, so the biggest thing is, again, a doctor you trust and who will answer your questions and take your weird symptoms seriously, because I got to tell you, almost I go to my primary for things and she says, that sounds like that's your cancer, go to your oncologist. And then my oncologist says, go to your primary for this. So there's that kind of thing. And it just happened to me recently. I think I may be developing gout in my right foot in an ankle, which is an unusual place to have gout, but every now and then I get a flare up of my ankle, really red, and feels like there's glass in the joint, can barely stand to walk. And, ice and elevation don't do anything for it. It's not injury related. It doesn't appear to be. And it might be 3 or 4 days of just pain, and then it goes away, which kind of sounds like gout, which can be a side effect of platelet overproduction. So I called my oncologist and said, hey, let's just add uric acid to my next lab. And she said, go to your PCP. And I said, my PCP is going to send me to you. Can I just add this to my next lab? And she said, okay. So there's a lot of that kind of stuff.
Fine.
Yeah.
I guess.
The bigger thing is less that and more pay attention to your body. So fatigue is real. But there are ways to help the fatigue. Early on, when the vertigo was bad, I managed the fatigue with a one-on-one Pilates instructor. I had a Pilates instructor who was very tuned into the fact that I had vertigo and gave me workouts that pushed me enough without pushing me over my limit. And keeping my body in shape really helped. Diet, if I stay hydrated, if I drink plenty of water, and I always have a big glass of water next to me, if I drink plenty of water and I eat kind of a Mediterranean diet, a clean, lean diet, I feel so much better than like right now when there's cookies and candies and I'm popping that kind of stuff. It's harder on the body, and given that you already have something else going on, the cleaner diet really helps.
Right.
And then the other big thing for me has been sleep and sleep hygiene. Being willing to turn off the phone and the computers at night and read a book or listen to a meditation tape or something like that, but have routine around sleep so that sleep is prioritized. Those things I think are keeping me as well as I can be.
Well, thank you for sharing all of that, Mary. We are going to now shift into your last segment, which will be talking about quality of life, living with cancer, and a lot of very important topics about the day-to-day stuff, what we actually deal with outside of treatment. So that will be Mary's last video.